The positive trial was designed in light of the fact that many young breast cancer patients still have not had a child or completed their family when they're diagnosed with breast cancer. And they desire pregnancy both at diagnosis and in their survivorship. And while retrospective evidence has demonstrated that there is no clear harm from a pregnancy after a breast cancer, the standard 5 to 10 years of endocrine therapy that we use to reduce risk in hormone-sensitive breast cancer is associated with a lot of time that can lead to the natural decline in fertility. And so we designed a practical study, the positive trial, to look at the interruption of endocrine therapy, so temporary interruption of endocrine therapy to attempt pregnancy, and then follow those patients over time after they get back on. The study was designed to follow a cohort of women enrolled within 18 to 30 months of starting their endocrine therapy. So they had to have been on at least 18 months of endocrine therapy and no longer than 30 months. And it was a single arm study. So women were eligible if they were 42 or younger, had had early stage breast cancer treated with curative intent, no signs of recurrence, were being treated with adjuvant endocrine therapy for hormone receptor positive disease history, and desired pregnancy. And they were enrolled, and then they had to have a 3-month washout of their endocrine therapy. So they stopped their endocrine therapy for at least 3 months before trying to get pregnant. They were encouraged to try to get pregnant for up to 2 years, and then to get back on after either pregnancy or no pregnancy. And if they got pregnant, carrying the pregnancy, obviously, hopefully to full term, delivering a healthy baby, hopefully, and then nursing if so desired. And the goal was to get them back onto endocrine therapy within 2 years, and then following them over time for both their disease outcomes, both any breast cancer event, as well as, importantly, distant events, as well as psychosocial outcomes, fertility and offspring outcomes. And then there's a big translational science component to the study as well. The key findings of the positive trial are that temporary interruption of endocrine therapy, as it was done in the positive trial for at least the population enrolled, did not appear to impact short-term disease outcomes. We specifically looked at a safety threshold, and there had to be no more than 46 events in the follow-up period, which is about 3 years after enrollment. And there were only 44 events in the positive cohort. We then used an external control group, which was selected from the text and soft clinical trials, similar populations, and we selected women that would have been eligible for positive, including 2 years into their endocrine therapy, because that's the average when people enrolled in positive. And we matched them based on several prognostic and predictive factors. And we did special testing to calculate the control group risks. And then we compared this external control group to the positive cohort. And we saw that there was no difference in all breast cancer events, as well as no difference in distance events between the positive cohort and the control group. So that leads us to no clear harm in pregnancy after breast cancer with a temporary interruption among women desiring pregnancy, as we demonstrated in the positive trial. That was the key finding. Other key findings from the positive trial included the fact that 74% of women who enrolled had at least one pregnancy. Most of them had the pregnancy within 2 years. And most of those women had live births. Birth defects were low at about 2%. And that appeared to be similar for age populations, similar in the general population. The clinical impact of the initial results from the positive trial tell us that at least in the short term, because follow-up was only approximately 3 years, which was on an average about 5 years out from diagnosis, temporary interruption of endocrine therapy in patients eligible for positive is a reasonable thing to do because it does not appear to impact on at least short-term disease outcomes. That being said, it's not for everyone. Some people did recur during the positive trial, as one might expect in a cohort of young breast cancer patients. And so women and their loved ones and their providers need to decide if a temporary interruption and to follow the positive protocol, now that it's out there and we know the results at least early on, is the right thing for them. But certainly it's reassuring for women who do want to try to have a pregnancy and want to take a temporary interruption of their endocrine therapy. And the other critical factor is we're going to follow these women long term. We want to go at least 10 years to follow them out for how they do with regard to their disease outcomes in particular, because in the setting of hormone receptor positive breast cancer, we know there's a late recurrence risk. The only other thing I would like to mention is that this study was really a labor of love, pun intended, both for the patients who could have gone and gotten pregnant on their own and not enrolled in a clinical trial to look at this. So they really did this both for themselves and for future patients to learn about the safety of having a baby after breast cancer and interrupting endocrine therapy, and also for all the investigators, the doctors who put these patients on trial, for doing this throughout the world. It really was a global effort, and I'm very grateful to have been able to be a part of it.